Dr. Issa Sharifah Musa is a medical provider at the Federal Medical Center, Keffi, Nigeria. She explains the impact of lupus among the African population and what can be done to assist patients.
Lupus is also known as systemic lupus erythematosus. It's an autoimmune disease in which the immune system tends to attack its own, the person's body, and it mostly affects the skin, the joints, the kidneys, the brain. In Africa, it's not very prevalent, but then in sub-Saharan Africa, the prevalence is about 1.7%. No, it can affect men, but here in Africa, it mostly affects women. It's mostly the disease of women, and then it tends to cause recurrent miscarriages for women, but mainly it's women. And then in Africa, we have the early onset type. It mostly affects younger women, but generally it affects women of childbearing age. There's a gene called apolipoprotein 1 that is seen in Africans, which is linked with lupus nephritis and end-stage lupus kidney disease, which can cause mortality very early for those patients. Secondly, is the environmental factors. We also have environmental factors like infectious agents like Epstein-Barr virus. So first of all, we tend to teach them how to prevent having flare-ups. One is to try to avoid sun exposure. So we tell them to wear clothes that cover up their body, use umbrellas, use sunscreen. We also tend to tell them to avoid anything that stresses them, whether physical or emotional stress. All those things can trigger a flare-up. Then when they present also, they are placed on medications like steroids. Steroids help to reduce the frequency of the flare-ups. We also place them on drugs like azathioprine. Because there's low accessibility to healthcare, these patients do not have access to even getting diagnosed. So most times here, and because we are very spiritual people, Africans, they will start thinking it's spiritual attack. Once someone has had fever, you're seeing rash and joint pain and it's recurring frequently, people will start thinking is maybe spiritual attack, and then they go the spiritual way and all of that. So that is one. Secondly, another thing, it still has to do with funding too, because it's not a very common disease. So there's limited research on it. So there's limited government willingness to actually, invest in this kind of diseases because they are not very common. So as such, those patients are left to just maybe to care for themselves by themselves, like source for funding, treatment, and all of that. And in a place where there's low resources, that can be very, very challenging.